are going to be presented by Ruduan. So Ruduan is one of our PhDs, just as Samson and Tesfit and Getu. And he did for his master thesis an analysis of, what are the statistical implications of keeping this data within federated 88 health facilities. That is not the same as that you put them all together in one cloud. So then if you want to analyze these for prognosis of epidemic situations, for instance, then how can we reflect on that? This is a very, very new field. It's obvious because until now we were really very much looking at centralizing systems for analytics, and now we are all, not just here in VODAN, but also more generally, I think Katie will say something about it later as well, because of the size of the data, we know we need to work with federated analytics. So hand over to you, Ruduan.
Okay, so I will go through it very quickly. We can go to the next slide. Oh yes, so thank you. So really broad overview of the methodology. Just if all these different hospitals, they're all locally repositoring data. We want to keep it this way, of course, and not only because of the privacy, also the legislation. And traditionally, it's really hard for hospitals to exchange any kind of knowledge. For example, a specific hospital may have an emergent disease, and the other hospitals, they may not know about it, they may report on it, but then it's quite late already if we have a formal definition on that. So really the purpose is that we can go to a community of hospitals, we can do some community building, and we can perform these queries, we can ask directed questions, and these questions can be very broad, very specific, based on what they allow to do. And these will give some kind of aggregate answer, for example, a case count or the presence of a certain disease or prognosis, the percentages, or even basic statistical models, and these are all anonymized. And this can be really helpful for a cluster level. For example, hypothesis testing, is there a really big difference between the regional areas, and is there a big difference between time horizons, etc. We can go to the next slide. Yeah, so really one of the biggest use cases of this is emergent diseases, as we've seen with COVID. And there's really a big emergence from certain regions. And this was detected quite late. And it was also quite hard to track kind of this early process when the disease is actually spreading and when we can have the most impact. And the idea is that if we can actually build this broad community of hospitals that are participating, and they are willing to participate because of this value that it also brings to them, and it brings some security, it brings also legislative control. And really by encouraging this process, we can also make sure that these emerging diseases are identified early. Another advantage, of course, it reduces also kind of the overhead costs of traditional monitoring, like it's a lot of manual work. And if we have actual like interoperable data systems, we can do this routinely, and we can also do routine auditing. And we can make sure that these queries that are performed, the research that are performed, that actually comply to this legislation. It can also be quite formally described. And of course, the broad idea is that we can shorten the time horizon of identifying these emergent diseases. Okay, next one. And the second big use case that you also covered is really the population and health. And I think this is really a really relevant topic now more than ever. And traditionally, we always look at individual patients, but more than now than ever, we see that the health outcomes of the individual, so it really also depends on the health of the entire population. Your chance of catching some disease really depends on kind of drug policy. It also depends on the health of the overall population, the measures we take to protect people, and also measures we take to increase health of people, like encouraging healthy lifestyles. And the only way we can really start to look at this is we start working together with different hospitals, and even across country lines. And this is one of the powerful things from VODAN. This is also kind of a completely new thing that so many countries are working together and 88 hospitals for the single goal, and that we can analyze their data in an aggregate level, and that we can help each of these 88 hospitals get more understanding of their population of patients, more understanding of how their status is of health in the broad scheme of things. So we can do some complex analysis like hypothesis testing, etc. And one of the big things also is reduce ambiguity, because this FAIR principles, you can do this queries, it's very clear, even through country lines. Okay, so this is a very broad overview. There's much more detail to this, and it was already quite presented nicely in the previous technical demonstration.
Thanks a lot, Ruduan.